This is the Grow Your Clinic podcast from Clinic Mastery. We help progressive health professionals to lead inspired teams, transform client experiences, and build clinics for good. Now, it's time to grow your clinic.
Well, welcome back to the Grow Your Clinic podcast. My name is Jack O'Brien, your host. It is fantastic to be with you for another episode today. We are recording this just before Christmas, and you're likely going to be listening to this early in 2020. So I hope you had a fantastic, refreshing break and that you are ready and raring to hit 2020 all guns blazing. So often we see clinic owners have the mindset of easing into the new year and blaming circumstances, etc. I think those progressive health clinic owners are the ones who hit 2020 full of energy, full of vigor, and ready to dominate. And today's guest is the perfect example. He epitomizes someone who really takes life by the horns and gives it a red hot dip. And I'm really excited to welcome one of the CM team's very own, Peter Flynn, to the podcast. Peter, how are you today?
I am good, thanks, my friend. Thank you very much for having me.
My pleasure. And listeners, if you're unfamiliar with Pete, perhaps you've been living under a rock, but Pete is one of the co-owners of Physio Fit in Adelaide, with a couple of locations around the city of Adelaide. He is a beloved member, coach and mentor on the Clinic Mastery team, and also a co-founder of iMove U, which is practitioner training. He is a well-known speaker at some of our Clinic Mastery Grow Your Workshop events. Man, that's a long bio, Pete. Tell us, what have you been up to today at the time of recording?
I actually dropped my car off to get serviced this morning and ended up having a bit of a business meeting with the owner of the service place. We sat down for about an hour and a half, really discussed, he has a knee problem. He knew I was a physio. We discussed that, and we've organised, he's just across the road from one of our clinics, that we're going to have a win-win scenario. He's going to offer us 10% to all our team members off of their car services. We're going to offer them 10% off our services at Physio Fit. But not only that, he's looking at doing a little bit of a preemptive thing for work cover. So if someone does get injured, can they get a few sessions early in? So something we're looking at doing is just a really random little thing this morning, but the people you meet, my friend.
Always working, right?
Always working, mate.
But that's it. Or the other way to look at it, it's not working. It's just finding opportunities to help more people, right?
That's it. I think that comes down to that. Shane Davis's favorite thing. How can we help more people? And it's just keeping your eye out for those opportunities, and when they come along, grasping them.
I love it. Well, listeners, if you're looking to learn more about Pete, I'm going to throw it in early. You can head over to clinicmastery.com/team, and Pete's profile is there, and we'll be able to link up all his socials out to all the other businesses that he's a part of. But today, Pete, before we dive into everything around communication and how that can help to improve the marketing of a health clinic, we've got a couple of rapid fire questions for you. Are you ready to go?
I like it. All right. I'm ready to go.
All right. These are blind listeners, so this could end up anywhere. But Pete, question number one, what are you reading or learning right now?
That's actually really interesting. I'm re-listening to Influence by Robert Cialdini. The reason why we make purchasing decisions, really very interesting.
I like it. Thank you. Number two, who inspires you?
Besides Shane Davis, one person that really inspires me is Vin Zhang. I really love how he communicates and his message around communication. Okay.
What's the 15-second pitch on who is Vin Zhang?
Who is Vin Zhang, the 15-second pitch? He is a magician from Adelaide who has now become an international keynote speaker. And on the side, he's created an amazing business around teaching communication. His philosophy is that you're only as good as you can communicate. People will only be able to judge you on how you communicate with them, essentially.
Yeah, I agree. Vin has taught me a lot, and we use a lot of his videos as part of our clinic communication training and culture and alignment days. Super, mate. Question number 3, what did you want to be growing up? And I asked this with a little bit of trepidation. I'm very interested. What did you want to be?
That's a great question. But if you know me, then I wanted to be a lot of things. I wanted to be a soccer player, and then it became a tennis player. It was back to soccer player for a while, then again to a tennis player. I did want to be a firefighter at one point. I actually did 6 months of engineering. We'll call it 6 weeks, but I was there for a semester. And finally, I wanted to be a sports scientist before I got into physio.
There you go. Amazing.
Like
A few different things. And finally, mate, what's a motto that you live by?
Be the person who gives more value.
Yeah, I love it, mate. And yeah, it's absolutely Tony Robbins. And I think that you really do embody that. That's awesome. Let's dive in, Pete. Can you run us through maybe the backstory on your experiences as a young physio and how you came to really engross yourself in the world of communication?
It really began early in my career. Essentially, I was by myself in a small clinic, and a lot of the time, as an inexperienced physio, people wouldn't get better. Now, some people would get a lot better really quickly, and others didn't get so much better. And I started to wonder, why does this happen? Why does it happen like this? I have two people very, very similar. One person I get along really, really well with. Like we just click. It's just really good. The other person I don't seem to click as well with. But the person that I like more, they seem to get better faster. And the other person, we struggled a little bit. It wasn't going as well. And then when I referred them on to someone else, maybe a more experienced practitioner or someone who had a more similar personality to them, they were able to get a much, much better result. And I started to wonder, well, why is this happening? Why is this happening to me and to everyone else? I saw the same patterns amongst many, many people. And it sort of led me down that communication pathway of going, why is communication so important in health? And how can we better improve our rapport, our relationships with people? And how does that affect the results this person gets? And there's actually an incredible body of research that shows that the better our rapport, the better our relationship or our patient-therapist alliance, the better the result someone gets. And it's glaringly obvious now that I see it. But at the time, I was like, wow, this is groundbreaking. If I can make this person like me more, it doesn't actually matter. A lot of the things that I do, they're going to get a better result. So that was where it began.
So, okay, if I can just press on a couple of questions that I have around this. I think, maybe your personality, your mindset, your open-mindedness to look at communication is something that maybe predisposed you. But how did that realization fit in with the paradigm of evidence-based practice that we learned at uni? Because you said there's a mountain of evidence behind communication, but I don't see that in the evidence-based medicine world. How did you reconcile that?
Evidence takes a long time, like a really long time to actually come into the light in the practice. There is a lot of evidence. It's done mainly in the medical field at the moment, and it's Patient Therapist Alliance they'll talk about. They're starting to have a great body of research in the chronic pain area as well. If you have a better Patient Therapist Alliance with someone, well, what effect does that have on treatment? And so for me, that's where it came into that evidence base. No one was really talking about this, and I was never taught it during uni. But if someone likes you more, they actually do what you ask. They actually come back when you ask them to come back. And the number one reason someone comes back to you as a physiotherapist is actually, oh, hey, they like you. It's not your skill, it's not the cost, it's the fact that they like you. And if you give someone a management plan and you ask them to do exercise, and exercise is not something they want to do while they're in pain, then if they like you more, they're more likely to do it. And we know if someone's more likely to stick to a management plan, they're more likely to get a great result. And so it was linking those two things together in my mind that made it really okay for evidence-based practice to focus on communication for me.
Okay, interesting. So no one told you that you had to do this, or what was it that piqued your interest at looking at how can we get more people better?
I think it was mainly just, to start with, it's a bit of ego, I think. Okay. For me, I wanted to be able to get everyone better. I wanted to be the best. And I think in everything I do, I sit on the spectrum a little bit, and I'm obsessive about everything that I do. And I want to be the best at everything I do. And that's why I played tennis. Daniel Gibbs pointed out that you practice serving for 2 hours, and you've got to be a little bit on the spectrum to do that. So that's okay. But for me, it was going, all right, well, if someone's going to come in and see me and I'm going to get the best possible result with them, I spend hours practicing techniques, practicing how I'm going to do this manipulation or this test or that test. But I was spending zero time practicing well, how do I build rapport and a relationship with someone? And what parts of communication actually make that more effective? Does that make sense?
It does, mate. It does. I think, listeners, I just want to lean into this a little bit because there's a key learning here. We could stop the podcast right now and it'd be a really strong learning here that, Pete, I'm picking up that you weren't so precious on just being excellent clinically, but there was a whole world of non-clinical skills that you realized that you needed to learn that we didn't get taught at uni, and that you weren't above learning some of these communication skills. Is that right?
Essentially, yeah, absolutely. It's the soft skills. It's the thing that we take for granted, that everyone should be able to communicate really well and develop really good relationships. And there's a saying, you'd have heard this growing up, treat others like you would like to be treated. However, that's actually a really bad saying, because if you treat other people like you would like to be treated, that only works if you hang out with people who are exactly like you. And if we can reframe that to treat others like they would like to be treated, and for their different personality type, how they communicate, you'll have much, much better results with all of your clients.
Absolutely agree. I love it. Okay. So what did you do when you realized that a lot of this hung on communication? How do you go about becoming a better communicator?
That was hard. That was very hard to begin with. I thought, well, how you talk is just how you talk, and how do you change that? You can't change that. That's just how you are. So I spent a bit of time looking into. I talked to people like yourself. Obviously, you're quite a well-known speaker, and you referred me on to Vin Zhang, which was his communication, his stage communication gym, as it's now called, on Facebook, which is a free group. You can join it, and they put a challenge up every 2 weeks that you have to do or you get kicked out. Recently, I did get kicked out because I forgot, but these things happen. I'll have to chat to Vin and see if he'll let me back in. On that group, there's a thing that goes through the five foundations. So the 5 foundations of speaking. And what that does is it dives into things like rate of speech, being able to pause, all the different things, your pitch, your tonality, your volume. So it goes into those 5 things, and it goes, why is each such so important? And where can you use these in order to get a better result? Because when you can start to play around with those, you can start to become a better communicator. And as with everything, everything's hard until you know how to do it. But once you get given the formula for improving your communication, and you start to understand things like matching, which is the number one way to build a relationship with someone, or rapport really quickly, is to match how they communicate to you. Maybe if I could, sorry.
Yeah, you go for it, Pete.
I was going to say, maybe if I just dive into that really, really quickly, the best example that I can give for this, and I think it's Tony Robbins that did a video on this matching, worth checking out, guys, is if you've got 2 people and they're talking to each other, but they have 2 very different communication styles. Now, what I mean is, imagine you've got a 15-year-old girl and she speaks really, really, really fast all the time. She speaks like this. She doesn't stop. She's just super, super fast in how she speaks. And she talks to someone and they talk really slowly. And someone that talks both those different ways. Now, if you're watching as an outsider, that's painful. Watching those people talk to each other, it is bloody painful. But imagine if you were one of those people. They hate each other. They genuinely hate talking to that person because they're so different. So how can we match how people talk to us? And that's hugely important in any health job, because when someone comes to see us, I used to think I had to be up and energized and I like this all of the time. But if someone comes into me and they're in pain and they're very softly spoken, and I'm like, hey, how you going? My name's Peter. It's nice to meet you. We're going to get you out of pain. They're just like, whoa, this guy's too much for me. Like, this guy's way over the top. So
he's probably had too many coffees.
Well, that's another thing. But yes, so exactly that. So it's just going, can you match that person where they're at? And then you can start to bring them up to maybe a higher level. But you've got to start where they are. You've got to start by being on their level of communication.
Yeah, I agree. Matching is such a powerful technique, especially probably for us as health professionals, all across the spectrum of health professionals. We are high achievers. We are high performers. We're often quite intellectual. And so it's easy for us to, especially in a health setting where we're the expert and patients are coming to us seeking our guidance, it's easy for us to become imposing or dominant in a relationship setting. And that creates difficulty when trying to build that rapport or that alliance. And so matching is such a brilliant way. We're going to loop back to where and how you learned some of those communication or verbal communication skills. Pete, how important has non-verbal communication skills been in your repertoire?
So non-verbal communication skills in, as a therapist in anything, it's huge. And just thinking about what non-verbals mean to the person in front of you, because what we say, it tells a story, but our body tells a story as well. Best example, charades. We can tell an incredible story just by using our body and no sound. It's super important that when we're discussing something with someone, when we're communicating with them, that whatever our body is doing is reinforcing what we are saying or even what we are doing. Now, what I mean by that is, let's say that you're talking to someone, and I'll give you a great example. If you're talking to a patient and you're facing your computer, you look up to hear them, and then you type, and then you look up to hear them again. You're not really giving them 100% of your attention, and you're also not really telling them that you care. Just the simple act of turning your chair towards them, facing them, leaning in and listening, it's huge. It's just incredible. People straight away, when someone does that, goes, all right, this person genuinely cares. Like, they genuinely care about me, about my story, and they're much more likely to open up, give us more details, let us in, essentially.
Pete, I want to pull on a thread that you touched on earlier. You said that often we have an excuse of, this is just the way I am, or this is how I communicate. Did it ever feel like you were putting on a front?
Absolutely. It was so funny. So when I actually did my first course on communication, it was a 3-day workshop that I did earlier this year in January, actually, with the good old Ben Lynch himself. I remember one of the things that Vin said was, on the first day, I want you to go home and I want you to talk to the people close to you. I want you to tell them that I'm going to be working on my communication. And it's going to sound weird because it's going to be different, because how you communicate is your personality. So just letting them know that I'm working on this and I want to change this for a positive result to move forwards and to improve this. And I'm just letting you know because it might be a little bit fake. It might be a little bit phony to you because it's going to be different. But I want it to be different. That's what I'm trying to do. And when you do start working on your communication, you feel really fake. When you start going louder and you're normally a quiet person, you're like, who's that? I'm not used to that person. But if you think about, if you go to the servo, or go to the shops and talk to the attendant there, and let's say you're normally a softly spoken, quiet person, and you go in and you go, hey, how you going? My name's Peter. Lovely to meet you. And they'll respond really normally to you because they don't know who you are. They don't have a mold that you sit in at the moment. And so to them, that's just you, and that's normal, and they like that. And it's getting used to maybe talking to people you don't know. That's where I would start. If you try and change your communication, it's talking to people you don't know, because guess what? They don't know you. They don't know how you communicate. They don't have any preconceived notions of how you should be talking to them. Whereas your family, your close friends, they might find that a bit weird.
Yeah, totally agree. Let's change gears a little bit, Pete. I want to know what's been the impact of this changing communication for yourself, your patients, and your marketing. And secondly, from a leadership perspective, how have you gone about coaching your team members? So firstly, let's speak to the impact of working on your communication skills. What has that meant from a tangible results perspective?
From a tangible results perspective, for me, it's opened a lot of doors, but it's also made me feel a lot more comfortable in different circumstances, because your voice is something you take, and how you communicate, you take that everywhere with you. And, if we talk about confidence, situational confidence it's a really big thing. Now, I used to be a tennis player, and when I had a tennis racket in my hand, I would be super confident. I knew I was good at it, and so I'd be confident in that sphere. But I might go to a networking event and not feel confident because I was like, different people, don't know them. What should I say? And I wasn't confident in how I spoke. But you can take your communication once you've worked on it anywhere with you. And so suddenly you can become confident going to a networking event because, you communicate well, or you're confident that you can develop rapport and relationships with all of the people around you. You can use storytelling as a way of building that. And so I think that was huge. The confidence to go to networking events, to speak in front of people, whether it be at gyms, GP practices, or anything really. So that in itself was massive. In terms of with patients, the result for me was people got better faster. People stopped cancelling. People would actually follow their management plans. This was massive to me. I was asking people to exercise that had never exercised before, or they hated exercise with a passion, and suddenly they were able to do it because they felt like that we connected. And because we were able to connect and have that relationship, they trusted that this was the way forwards. So in all those different areas, I saw massive improvements.
Pete, I love that because you've spoken to better client outcomes and better client experiences. And, as a consequence of that, some of the KPIs or CEIs that we measure, maybe PVA, rebooking rates, lifetime value of clients, I'm sure have improved, but that's a byproduct of better outcomes and experiences, right?
Exactly. It's just a massive byproduct. If you can improve your communication, you'll see all those things improve. And another big one you'll see improve is word of mouth referrals, which is the biggest compliment as a health professional.
Love it. Okay, so let's talk then about your team. How do you go about training your therapist and admin team around their communication skills?
Challenging as always. When you go to work with someone on communication, it's difficult, I think, to begin with, because to bring up the fact that, hey, let's work on our communication is almost to say to someone how you communicate isn't quite good enough, because communication is such a personal thing. It's how you speak all the time. And it's quite a hard topic to broach, I think, initially. And it has to be done in a really positive light of client outcomes and opportunities to improve. Because the last thing you want to do is say, you're actually really awkward sometimes, and I don't know, a little bit of eye contact would be super nice. It's instead going, what are the opportunities to improve here, and relating it back to when you go through their dashboard with them. If you're a CM member, you know a bit about that. So, a dashboard would look at maybe the cancel percentage. And so for the person who's got maybe 15 or 20% cancels, it's sitting down and going, well, the 15 to 20% it's just a number. That's just a number. And that's okay, because we're going to work on that. But what I really want to understand is the story behind that number. Now, for me, the story behind cancellations is that we haven't developed a good relationship with that person and we haven't communicated the plan well. So what we're going to work on at the moment is we're going to work on how we communicate the plan better and what are the opportunities to create a better relationship with each person in front of us. And I'm sure if we work on those things, the cancel percentage will decrease. So let's not focus on the number. Let's focus on the story behind that number.
That's good, mate. And I think it really speaks to clinic owners. If you're thinking, I really need to help my team member improve their communication skills, probably what you need to wind back a couple of steps is thinking, all right, we need a culture of lifelong learning amongst our team, that it's okay to find opportunities and room to grow. And then, like you said, Pete, it's running through, as part of our Clinic Mastery Business Academy, it's running through your business dashboards and your practitioner dashboards and using numbers to guide our learning that will ultimately improve client outcomes. What other pearls have you got for us when it comes to leadership and communication, Pete?
Leadership and communication. Look, it's hard. I think it's just recognizing that yourself as the leader within any organization, any team, it's your job. It's absolutely your job to be malleable and to change your communication style to the person in front of you. If you're a leader, it's not your team member's job to communicate to you how you want to be communicated to. It's your job to change to them. And that was something that I initially struggled a lot with. And I've got a great example here. And Sammy, if you're listening, I love you, but this is a funny story about us. So Sammy's my practice manager and she's an absolute weapon. But we communicate very, very differently. I'm very logical. I like things, facts, figures. If it can be said in 10 words, please say it in 3. Sammy's the complete opposite. If it can be said in 3 words, let's talk about it for half an hour. And you can see there's this mismatch of how we both like to be communicated to. Now, there has to be a middle ground here, but my job as the leader or a leader within that business and that team is to make sure that I'm actually focusing more on changing my communication style to meet her needs. And it doesn't matter who it is within your team, but starting to understand, how does this person like to be communicated to? What do they respond well to? Are they someone that just, they want it straight? They want to know about it. They want it in written first. Written is still a form of communication. We have some people who would like a written form of communication before we have a meeting so they know what to expect. And that's their personality type. But it's starting to understand and maybe even keep a little spreadsheet on how people like to be communicated to within your business.
That's awesome, mate. A really good little actionable takeaway. If a clinic owner is thinking, well, how do I even find out how do people like to be communicated to? How would we do that, Pete?
Oh, that's a good one, actually. There's the color code test. If you Google color code test, you have to write color, the American color, COLOR, color code test. It's actually it's a personality test, but it's based around communication styles. And it's absolutely fascinating. If you pay the $39, I think it is, you'll actually be able to get all of the data that goes with it that explains, how should you communicate with this person? How should you not communicate with this person? And what are their communication strengths and weaknesses? It's fascinating.
Brilliant. I actually haven't done that for my team. So that's my action point from this podcast. And listeners, I hope you have a list of action points. Pete, what we do is we've often used the love languages test, or which has now been improved to be the languages of appreciation at work. And we find that a really good tool. Yeah. Well, Pete, I'm gonna land this plane. It's been a fascinating conversation. Thank you so much for sharing your insights on communication, leadership, and how that applies as a clinic owner and in clinical practice. It's been real, mate. Thank you.
Thank you so much for having me, Jackie.
My pleasure. And listeners, you can grab all the show notes over at clinicmastery.com/podcast, all the resources, notes, and links to check out Pete and his clinic at Physio Fit Adelaide, and also I Move You, which is practitioner training for your young, recent, or maybe not so recent graduates on all the clinical and non-clinical skills in being a private practice practitioner. That'll all be linked up over at the show notes. But listeners, thank you so much for tuning in. We really appreciate your attention as well as your honest reviews and ratings wherever you're listening to this. Peter Flynn, thank you for joining us, and we can't wait to bring you another episode of the Grow Your Clinic podcast again.
Thanks for tuning in to the Grow Your Clinic podcast. To find out more about past episodes or how we can help you, head to www.clinicmastery.com/podcast, and please remember to rate and review us on your podcast player of choice. See you on the next episode.